So what I'm going to talk about today is a type of case that my clinical students work, and it points out a real injustice, and we are able to help veterans in this one type of case. It's called a discharge upgrade. And so the typical case is a service member, let's say an Army soldier, who deploys and he's fighting in war and he experiences combat trauma. Maybe he sees a fellow service member killed in action. And then that combat trauma causes PTSD, and he's not yet diagnosed with it, but he starts to experience symptoms. And so because of the symptoms of PTSD, he might show up late to formation, or maybe the anxiety is so much that he chooses to self-medicate his symptoms with marijuana, something like that. And so this sort of minor misconduct leads to him getting in trouble with the service, because the military has lots of really strict rules, especially about drug use, and ultimately leads to his administrative separation from the service. And he isn't separated honorably, which most veterans are separated honorably. Instead, he's given a less than honorable discharge. And so even though really his conduct was caused by the mental health condition the service experience sort of gave to him, his misconduct then, it doesn't have a victim, it's not like violent misconduct, it might be marijuana use, then leads to his less than honorable discharge. And what that does to the veteran is really stigmatizes him and inhibits his ability to call himself a veteran in many ways. He can't get the support from the Department of Veterans Affairs in terms of disability compensation for disabilities that he got in service or healthcare. He then has to report the level of his discharge when he applies to jobs, because every veteran has to report, turn in their DD-214, which is their exit document, and report what level of discharge that they got. And many employers won't hire veterans with less than honorable discharge. So his less than honorable discharge really stigmatizes him. It limits his employment opportunities. And in many instances, it gives him a feeling of shame for something he was otherwise so proud of. And so in our program and in veterans clinics across the country in law schools, and also pro bono attorneys across the country, take these cases on a pro bono basis. And my students and I work the case. And so what we do is we first interview the veteran about his story. And oftentimes it's very sensitive for him to talk about his story, because it brings back memories which are really triggering for him, because they're involved in his PTSD from war. And then we help him to prepare an affidavit that sort of says, this was the type of soldier I was before the trauma. This is the trauma that I had. And then this is what happened to me after. And at the time, I didn't really realize it, but PTSD had emerged and I was self-medicating. And then this is what it did to me after I was discharged. This is how I've battled my mental illness from service. And this is how I've handled that less than honorable discharge. And then it's sort of a plea to upgrade the discharge based on equity. So we get a statement from the veteran, and then we collect his private medical records. Let's say that he exited service, and since then he was diagnosed with PTSD and he's been getting therapy and maybe medication. So we get his private treatment records that show that diagnosis. Maybe his private physician said, yes, he thinks that the condition, the mental health condition, arose in service and was caused by service. And so we do that. We also collect what we call buddy statements, or sort of affidavits from other people. So maybe he had fellow service members who saw the trauma, experienced the trauma as well. Maybe we have, and they can write a statement in support of him. Maybe we have fellow service members who say, yes, he was a stellar soldier, and then this happened to him and things changed. You know, he couldn't sleep and he was showing up late to work and he was confused, you know, he was exhibiting symptoms. So we gather statements, and this is called lay evidence, to support our brief, which we filed to the military service boards. And so we're filing it to the service he was in, whether it be the Army, the Navy, the Air Force. And we base these equity arguments. We say, you know, this was a good soldier. He had lots of awards. Something happened while he was in service, and then he got his mental health condition in service. And the mental health condition is connected to his service, and his misconduct that led to his discharge is connected to his trauma in service. And so we've taken several of these cases. They take a long time for the service board to decide, but it's an amazing life-changing event for the veteran to help him be able to upgrade his discharge. And then he can call himself a veteran again. He can have the benefit of VA services, and it just restores a sense of pride, the pride he felt when he was serving active duty. So that's one type of discharge upgrade case that we take. Another type that we take is that there are many, many service members who were discharged less than honorably based on their sexual orientation. In the don't ask, don't tell timeframe, and before that, the policy which prohibited homosexuals from serving in the military. So we've had clients who did no misconduct, were stellar service members, and all that happened is that a rumor escaped on base that they were gay, and then they were interrogated about it, and they admitted it, and they were kicked out less than honorably. So we write a different sort of brief for these service members because we're saying something different, but we're saying, this was an unjust policy. The policy has now changed. Homosexuals can serve in active duty military. There's no policy targeting sexual orientation anymore. And so this service member deserves an honorable discharge. And so we've had some of those cases as well. And collecting the statements from those veterans can be very sad because it can, by modern standards, it's very upsetting how some of them were treated in service, sort of witch hunts. So the cases are really gratifying for the students, and working with the clients is such a wonderful experience for them to gain skills and to know that they've really helped with the just cause. We also get to partner with medical experts like mental health professionals who will review the records and then opine as to whether they believe that the misconduct is typical of someone suffering PTSD and likely resulted from the trauma in service. That's it. I just wanted to tell you about that kind of case. It's a wonderful case to work on, and I just wanted to tell you about this injustice that we try to rectify.